In our 2021 survey, emotional and mental health emerged as a significant theme throughout all of the findings. This was particularly quite stark because we didn't ask any questions on emotional health in last year's survey. However, as a result of this, I have included specific overarching questions, just so that we can try and understand a bit more about what's going on. So we asked respondents if the emotional health of those they worked with had changed over the last 12 months. As you can see, the overwhelming majority said that the emotional health of both parents and carers and children and young people has got worse over the last 12 months. We asked practitioners to comment on why they'd chosen their answers, and the bullet points on the right on the screen reflect some of the most common reasons they gave. They describe many parents and carers as being constantly worried, stressed and anxious, and this often affected their ability to parent as they would want to, or even to make considered decisions. For children and young people, they are seeing increased numbers who are self-isolating, being disengaged, and also continually living with stress and anxiety. And the practitioner said that this stress and anxiety was particularly around food, debt, staying in their own home and being worried about their parents. Sadly, they described many children as being depressed and sad and anxious. What was also very stark from the findings was the depth of deterioration and the increase in the numbers who were now felt to be either at a critical point or in crisis. And a significant number of practitioners reported an increase in the numbers of children, young people and parents who were at severe and immediate risk. Some of these children are aged under 10. This was commented on across the wide range of sectors who responded to the survey, and the poor emotional health was also commented on and reflected by children and young people in their own survey. However, I have to say we didn't ask children and young people specifically about emotional health, but they mentioned it so frequently, it was the dominant theme in their survey, in their findings. And sadly, they also talked about severe risk. In terms of support, respondents said that they are making more and more referrals to mental health services, but they also said that the waiting lists are very long for both adults and children. And they felt that this would only increase due to the rising demand that they're seeing and the number of referrals that they're trying to make. Now, I also asked practitioners and professionals about their own mental health, and this was as a result of the number of comments made by them in last year's survey. So the question in the survey simply asked, how are you? And this was a completely optional question, and 57% of them did respond. Of these, it was heartening to hear that 44% are doing well. However, the majority of those who did respond are impacted by their experiences. Some practitioners shared that they're struggling financially as well, and therefore it's often difficult emotionally to provide support to families when they themselves are in the same position. Many described the emotional toll this was having on them, leaving them feeling helpless and failing in their role. Now, although some had experienced this for many years, they stated that the situation in recent times was making it increasingly difficult. Some had taken time off with work-related stress, whilst others are actively seeking other employment in order to remove themselves completely from the situation and the sector. Now, where this was the case, again, they expressed sadness and regret that they no longer were able to stay in the role that they did love and had experience and quite often training in. I have to say, though, that despite these circumstances, the overarching concerns of the workforce do remain with the children and young people they work with. And my hope in bringing this to bear, really, highlighting this as an issue, is that everybody starts to understand more about the wider impact of poverty, and I hope that this encourages further conversations and understanding and support within organisations.